I know when I did my undergraduate training at dental school, I was often taught not to bother to send the patient to an orthodontist until all of their teeth were through at around about age 12. And I often had in my mind that meant that they were only really thinking about the teeth and the adult teeth. When you and I both know that there's a bit more to orthodontics than just moving the teeth. What do you think about that?
Well, I agree. When I was taught as an undergraduate, we were always told only refer to the orthodontist once the permanent teeth have erupted, and that's why I practiced in the first few years after graduating. But clearly now there's a better understanding of what can be done before the eruption of permanent teeth. I think if we look at facial growth and eruption of permanent teeth, by the time all the permanent teeth have erupted, we've pretty much gone through our facial growth. In the modern approach to orthodontics, functional jaw orthopedics, etc., I think there's three distinctive phases that a child would go through when treatment can be rendered. Early treatment, which would involve breaking of habits, such as thumb sucking, such as a crossbite, which is related to the narrow upper jaw, such as a child who has a tongue thrust. Anything that, if it's treated early, would allow facial growth and development to go back to normal. Then there's that second phase of treatment, if you want to call it that, which we call orthopedics, and as the term suggests, it's guidance of growth related to changing bony architecture. And in that regard, I look now at children who are between 7 and 9 who have a narrow upper jaw that won't have enough room to accommodate their teeth. And at that age, it's quite easy to develop the jaw to make space for the teeth to come through. And then the last stage of treatment, which most parents would be familiar with, and certainly the way we were trained in our original undergraduate training, is orthodontics, which relies on movement of teeth with all the teeth being present. And we're not to say that every child needs all three phases of treatment, but certainly those children who have facial imbalance or have not enough room for the eruption of their teeth, they would benefit from the earlier treatment.
Sure.